Hi, everyone. I'm Sandra Arevalo from Montefiore Nyack Hospital. I'm the Director of Community Health and Wellness. And today is Community Chats. We are dedicating these community chats to National Nutrition Month. So here we're going to be talking about different programs that we have here in Rockland County that relate to nutrition services, food insecurity. We have actually a lot to offer in Rockland for all its residents, but I'm sure not everybody knows how much is there to access. So for that, we have a robust, great panel today from three different organizations, all doing different work, but all together really keep the nutrition health of Rockland residents in place. So today with us, we have Amanda Capadona from SNAP Ed New York, part of Cornell Cooperative Extension, Michelle Kleinman from the Department of Health, and Julian Palmer from Touch. And of course, they're going to be telling us what each one of those are. So that's why I'm not going to give you a lot of details. Each of them has a little presentation, and then we're going to leave some time at the end for questions. So please, if you are attending today, just ask all the questions, use the Q&A, use the chat. I'll be happy to share your questions, ideas, comments with them towards the end. So without further ado, Amanda, why don't we start with you? You tell us a little bit about yourself, and then if you want to share your presentation.
Sure, of course. My name is Amanda Capadona. I'm a nutrition educator for SNAP Ed New York. We work out of Cornell Cooperative Extension in Stony Point. So I'll talk a little bit about that later. But I'm a nutrition educator and a registered dietitian. So I do community education, and then we do other programs, which I'll elaborate on in the presentation. So I can share my screen. Okay. All right. And okay, I'll just get started.
Go ahead.
All right.
Great.
Awesome. Good. So we are SNAP Ed. We are a regional program. My program, I do work out of the Rockland office, but we are the Hudson Valley region. So I'm gonna focus on Rockland County, but that is just kind of where our program is across the Hudson Valley. We're across all 9 counties. So just kind of what I'm going to go over. I'm going to go over what the difference between SNAP and SNAP Ed is, because there's a lot of confusion there. I get a lot of questions about that. We'll talk about why we do what we do, facts and stats in Rockland County specifically, and the partnerships that we do in the community. So what is SNAP? So SNAP is the Supplemental Nutrition Assistance Program, formerly known as food stamps. It helps low-income families buy food. So it is a program for low-income families so they can help afford food for their families. So SNAP Ed is a little bit different. So SNAP Ed, we do not like, and I just want to be clear about this because I get this question a lot. We do not do signups for SNAP Ed. We do not do screenings for SNAP. So we are the educational component of SNAP. So we are, funded the same way SNAP is funded. We're funded by the Farm Bill, but we do not do screenings for food stamps. We do nutrition education for the population that receives food stamps or is eligible for food stamps, because not everyone who's eligible actually signs up, right? So we focus on helping low-income people and people who are food insecure improve their diet and prevent chronic disease. So our overall mission is just, we want people who qualify for SNAP, who are low income, who have trouble affording food, eat better and move more. So eat more fruits and vegetables, eat more fresh foods, eat more foods that are beneficial to them, and do more physical activity to help prevent chronic disease. Oh, sorry, my slides are being moody. Okay, here we go. And this is Maria Brown. This is the other educator in Rockland County. She has programming right now, so she wasn't able to attend with me. So we do nutrition education is our primary kind of what we do. We do workshops in English and Spanish. We deliver in any place that has 50% or more free or reduced price lunch. So kids that are receiving lunch for free or at a lower cost at their schools. So that in Rockland County encompasses North Rockland School District, East Ramapo School District, and then parts of Suffern. So some of the schools in Suffern qualify, not all of them do, like how North Rockland and East Ramapo, our whole counties qualify, or our whole, school districts qualify. Suffern is not like that. There are some individual schools that qualify. So we support those healthy eating habits through workshops and community programs. Okay, so how does this work? So we are all based on evidence-based methods. So all of our curricula, all of the activities that we do are proven to be effective in some way. There's been research behind them that shows that they show actual behavior change. So we do single sessions, especially for organizations that are super busy, don't have time for us to be coming in every single week. We'll do single sessions. We do multi-sessions as well. So we'll do week by week in organizations that have folks that are eligible for food stamps. We do a lot of work in schools, but we do work with organizations as well. We have some senior centers. I've been to Julian's a couple of times. I work with some of his clients as well. And then we have community public health events. So we'll do like tablings now and again. But then what we really push, what we really work toward, we make those community connections, but our goal is to have policies, systems, and environmental changes. So that's a big, I want to explain what that is. So anything that creates lasting health improvements in that organization or community. So there's lots of different ways we can do that. I'll be talking about the programs, but some of this information is also available on our website. But these would be some of the like resources we would give out to the communities. We have tons of tip sheets. We have tons of videos. So it's not limited to just our community work and the workshops that we do. We have a website as well, snapednewyork.com. And you would be able to go there. We have a kids corner, we have recipe sections, we have tip sheets, all kinds of information and education. Okay, I'm not going to go through all of this, but basically just what you need to know. SNAP-Ed New York is coordinated by New York State Office of Temporary and Disability Assistance. So it's administered by a couple different providers in New York State. Cornell Cooperative Extension is the SNAP-Ed that I work out of. So that's not true for all of New York, and especially when it comes to like New York City. But for us, for SNAP-Ed Hudson Valley, we're out of Cornell Cooperative Extension, and we're overseen by New York OTDA. And this is our team, just to show real quick. So like I said, we're across all 9 counties. We have folks who speak Spanish, French. We have folks from Ecuador, Benin, Senegal, Nepal, Peru. We have a very diverse team. So yeah, we kind of, we're from all over the place. Okay, so why does it matter? I know I don't want to take too long because I know that we have I want everyone to be able to talk because everyone else has so much to talk about, and it's so important. But more or less, we want to reduce chronic disease. So we probably all know someone with hypertension, high cholesterol, heart disease, type 2 diabetes, cancer, depression. And this ties into food insecurity and stress, right? So this is just an infographic kind of looking at food insecurity as a source of stress. So we have food insecurity, people try to cope with that. They might decrease their dietary quality, buy cheaper food, change their eating behaviors, eat less, eat at different times. This decreases bandwidth for just like everything from coping for surviving. This can lead to chronic disease. That's going to increase your healthcare expenditures and unfortunately decrease your employability. That's just the way the world is, right? So that's going to decrease your household income. That's going to increase your spending trade-offs. That's going to continue the cycle of food insecurity. So this is a big cycle that people get stuck in. So that's part of why we want to teach how to utilize SNAP, how to utilize food assistance in a healthier way to live a healthier life. And just to highlight, because in Rockland County, this is an issue. So I talked about chronic disease. These numbers have stayed pretty steady. Granted, these numbers are from 2021, but that's just because that's the source that I had right now. We don't have the most recent numbers for this survey. But diabetes and prediabetes are at 9.4% and 12.6% respectively. These are people who have been diagnosed by a health professional. So keep that in mind because not everyone who has diabetes or prediabetes knows that. High blood pressure, 26%, and then heart disease, 5.7%. And we know that over 94,000 people in Rockland need help for affording food from their families. This is from Rockland Community Against Hunger's website. So this is about 1 in 4 people in Rockland County. So this is relevant to Rockland County. We might not be necessarily thinking of this as an area where tons of people are on food stamps, but there is a need. There's a huge need that exists. So food in both quality and quantity consumed is crucial to optimal health. So in food insecure households, the need for food competes with the need for other basic human necessities, medication, housing, utilities, transportation. And this is a public health issue, right? That creates a huge public health issue. People cannot afford food that keeps them healthy. They cannot afford enough food or safe food. And they're really making those trade-offs between medication and housing. So how do we work to kind of affect the community when our focus is nutrition education? We have a multi-pronged approach. So we have our workshops, we have our policy systems and environmental efforts where we go into organizations or communities and try to make changes that support health. And then we also have social marketing, which I'm excited to talk about. We have a texting program in North Rockland, East Ramapo, and Suffern school districts. And we have a general sign up too, so you can sign up if you're not in those districts as well. But each of these approaches involves education, collaboration, facilitation, and coordination. So we really try to work together. I'm not going to go too much into our nutrition education and physical activity, but just what you need to know. It's an interactive workshop. We have hands-on activities. This is our educator, Maria Vele, with a couple of folks doing a food demo. So we do offer food demos. It's not always requested, but it's something that we're able to offer. Again, we have evidence-based curricula. We offer resources and reinforcements like small gifts if someone does a series. We also do evaluation. We do surveys to make sure that our lessons are being effective. So this is just an example of one of the physical props that we might bring to, especially this would be more for like a youth class, but this is the sugar. If you had one bottle of this drink a day for 1 week, that's the amount of sugar that you consume in 1 week per drink. So you can see there's like an orange flavored drink, a vitamin water, Gatorade. So these just to show how much sugar you're physically consuming in 1 week. So that would be an example of something we do. We'd also talk to them about what they drink. We might ask them like, what is your favorite drink? I can look up that nutrition facts label and then I can show them how many teaspoons of sugar they're having when they have that drink, because I can do the math in front of them. 4 grams of sugar is 1 teaspoon of sugar. So I can take that 64 grams in this soda here, divide by 4, and I can tell them, I can spoon it out in front of them, how many teaspoons of sugar that you're consuming every time you have that drink. Because seeing that usually is very eye-opening to them, because they do not know, grams is not obvious to everyone. Teaspoons is a much better visual. So it can be really eye-opening for these kids and adults as well. Okay. So education is great. I can tell people all day to eat healthy, but what if the structures in place don't allow for that education to move to practice? This is where our PSE, policy systems, environmental efforts, and social marketing comes in. So social marketing is basically, instead of selling a product, we're selling a behavior or a lifestyle. These are good examples. Telling people to eat fruits and vegetables, drink water, move more, reminders. We make it look attractive. We make it look colorful. Let me actually move ahead a little bit. I want to talk about this first, and then I'll talk about FERX. So this is our texting program. So this is one of our social marketing that we have. So it's 1 to 2 texts a week. We do time-saving solutions. We send out recipes, videos, all kinds of stuff. We usually will link back to our website. And there's some of them that are like interactive. We also send reminders if we have something like a Facebook Live, which I'll talk about in a second, because we have some Facebook Lives for March for National Nutrition Month. So we have, like I said, North Rockland, East Ramapo, and Suffern. So it's North Rock, 89860, East Ramapo, 89860, or Suffern, 89860. I don't have the graphics for Suffern yet. Or folks can put SNAP-Ed NY to 89860, and it'll sign them up for general. So again, it's 1 to 2 texts a week with healthy information. Links back to our website often, snapedny.org. So, and then we also have our YouTube channel. But I do want to talk a little bit about our fruit and vegetable prescription program, because this is another thing that very, very gratefully Julian worked with us on. So fruit and vegetable prescription program, this is a program where we worked with medical providers or folks that could refer, like a registered dietitian, for example, folks who are food insecure to us. We did nutrition education sessions. So we did up to 10. They could receive $12 for each session that they attended. That could be used at select stores. So we have this program running in Ulster, Orange, and Rockland. So this is a sample of like what the voucher looked like. It was 4 $3 vouchers that they would receive for each class that they attended. In Rockland County, we did have Cropsey Farm. Obviously, we do not have Cropsey Farm as a vendor anymore. And then we had Food Fair as our other vendor. And we're always looking for more vendors. But they can exchange their vouchers there for fresh fruits and vegetables only. So it was just an extra way they could get those extra fruits and vegetables. And then this was a picture that I got from a participant that I was really excited to share because we talk about goal setting a lot. This person's goal was to eat more green and purple fruits and vegetables. And then I got this really awesome picture from them. So I was really, really excited about that. All right. So, and I'll wrap up now because I know we have to move on, but we are celebrating National Nutrition Month with SNAP-Ed New York. We have some sessions coming up. Maria and I are going to be the first session on March 14th. And then there's going to be another session on the 21st and 28th. So ours is Herb Your Enthusiasm because we're doing an herb potato salad. So we'll do nutrition tips. We're also going to talk about connecting with a nutrition professional because that's the theme of the second week in March for National Nutrition Month. So it'll be Friday, March 14th at 12:30 on the SNAP-Ed New York website. SNAP-Ed New York, sorry, Facebook, because it's a Facebook Live. So you'll be able to watch us there do a recipe demo and talk a little bit about connecting with a nutrition professional. All right, and I think that's it. I don't want to take up too much time, so.
No, that was awesome, and thank you so much. And I know that you were in a hurry because you guys do so much.
Yes.
You just did it in 17 minutes. That's amazing. Michelle, how are you?
Hi, good afternoon, everybody. So I'm going to do the share. I hit the share.
Yes, and in the
Okay.
meantime, while you pull up your slides, do you want to tell us, I know you're in the OH, but do you want to tell us a little bit about yourself?
Yes, yes. So I think I have it here. Let's see. Is it there? Can you see it?
Not yet. Now we
No?
do.
Okay. Hi, everybody. My name is Michelle Kleiman. I am with the Rockland County Department of Health. I have been a public health nutritionist, and now I am a public health educator for the Rockland County Department of Health. I want to thank Sandra, Julian, and Amanda. I really want to thank Sandra for inviting me, the Rockland County Department of Health, but I'll be speaking a little bit on other programs that Rockland County has. There are several departments in Rockland County that address nutrition and other needs. I loved the theme. This is March is National Nutrition Month. To me, every day is nutrition because we have to eat every day. So every day you can make, and we hope to get you to the point where you can make, or you're able to make a healthy choice. Not everybody can for certain reasons, but that's our goal. The food connects us is a great theme because it's very broad to me, but it also can be that piece that the health department or Rockland County can really connect people with options and connect them where to find food. And I know Julian will be talking about that later with the Rockland Community Against Hunger. So I'm going to tell myself next slide. We're going to start at the very beginning. That's always a good place to start, right? So the Lactation and Promotion and Support Program in Rockland County, we are very lucky. We had a lactation or breastfeeding, chest feeding program. And I feel that this is so important because somebody as such as myself, breastfeeding or chest feeding there were some I would say challenges for myself. So it was very good to have a lactation person that could give me some assistance. This is a free of charge, and I put the information there. And it's also the other program that we have is opportunities to any work site in Rockland. We can help make that work site a lactation, we say friendly, but it's a law in New York State that you can breastfeed anywhere. Anywhere you can breastfeed. However, if you're at work and your child is somewhere else and you need to use a pumping or you have access to have your child on site, we can help with making a room and also help with some policies. So that is an option. Please take us up on it. Thank you. That's one. And I'm going to go to the next slide. WIC. WIC stands for Women, Infants, and Children. It's a supplemental food and nutrition program, and it's for pregnant women and children up to age 5. and that is supplemental, will provide some different foods, really those high, I say high nutrition foods, milk, dairy. It also has tuna, it has beans. It could be really just that, especially in eggs, because we know what the price of eggs is now. So it's very fills in where that protein where you need it. The next is our chronic disease program. Chronic disease chronic disease can be arthritis, it can be cancer, it can be diabetes. It's a disease that is, you can live with it, such as HIV. Years ago, chronic disease, HIV was not considered a chronic disease because you may have passed away from it, but now people live with HIV. Same with, same with cancer. You could be living with cancer, arthritis, depression, any of those diseases we can help. Our chronic disease prevention program is, actually, I wrote that wrong, everybody. It's the chronic disease management program, and it helps you manage your disease. When you have a disease such as, I'll just say arthritis, to manage pain, to manage how to speak to your loved ones about it, to manage how to go to the doctor and speak to your healthcare professional on what you need, to manage how to look at the nutrition. This is a 6-week program. It's 2.5 hours. It's free, and it's facilitated, but you learn from your peers too. It's very, very valuable. We get people first tell me, oh, it's 6 weeks, 2.5 hours. And then they don't want to leave. The other one is the Living Well with Diabetes program. And I want to say it's not only for the person who has diabetes, it could be also for their caregiver, their loved one, the person who's helping them manage this disease. The next one is the National Diabetes Prevention Program. So if you have pre-diabetes, there's that window of time that we are talking about prevention. And we don't want you to convert to diabetes. So that window of time is working to look at your lifestyle or things that maybe you can fine tune so you can prevent diabetes. And people who've taken this class, and it's a year-long class, Sandra, you can jump in anytime, with the diabetes prevention program, have prevented diabetes, some people for up to 7 years and longer. But that was the last stat information that I had seen in a journal from the Academy of Dietetics. The next one we have is our Tai Chi program for arthritis, and we have a fall prevention program. This, I will say, I'm going to put a call out because we definitely need some facilitators and we do training, but this is our biggest demand program. It is 8 weeks, and we really work on how to recognize and prevent falls. And any of our programs, please call 845-364-2500. Our worksite wellness program. Well, we talk to any worksite in Rockland we will work with, looking at their vending machine policy. We look at helping to put healthier choices in the vending machine. This I just want to give a shout out to. This is West Havistraw Elementary School. They had a reading program, and I thought that was fantastic that when I used to do this reading program years ago, I would walk in and there would be a big box of donuts and coffee and just a big box of donuts. And, oh, you want some refreshments? So working with them, we said, well, why don't we offer some healthier choices? And you could see right there, it's bananas. They have different healthier choices, water, and they have smaller packages of potato chips versus the big packages. So they're just one of my stars. Another one is Catholic Charities Community Services. When they have events, look at those healthy choices. We also do health fairs. If you'd like us to come to your health fair, we are free. We promote, similar to what Amanda had, These are very high demand, my sugar models, my sugar sweetened beverages sugar models. Outreach we will do, so please, we will go anywhere and everywhere. It's a shameless plug, right? Does that sound shameless? Our Creating Healthy Schools and Communities. This is a grant that we received from the New York State Department of Health, and we're focusing in the North Rockland School District. We work with the town of Haverstraw, but we are primarily focused, I have to say, the village of Haverstraw and the village of West Haverstraw have embraced many of our programs. If you go to the village of West Haverstraw, Peck's Pond now has it's called a story walk. So they have a story on their walking path, and that we partnered with the Haverstraw King's Daughters Library. I was lucky enough, I'm working with the North Rockland Central School District, and we are working to put some food pantries right at the schools, and working with families because they already have a relationship with the North Rockland Family Resource Center, and we had the food pantries right there. We were able to do that. So I'll show you. So this is a food pantry. This is First Baptist Church. To all the way to your left is the old refrigerator. And Julian will probably tell you this, that many of our pantries have refrigerators like this. It's someone's refrigerator that looks like it's around 1982. But that's the kind of refrigerators that they have. And they're usually ones from someone's home, or it has been there for years. Someone donated it. The grant that we have through the Creating Healthy Schools and Communities has been able to provide funds and working with pantries. So now they can have that space to have more produce, more fruits and vegetables, more healthier choices. So I'll show you. And that is Pastor Gene. Look at him smiling. Sure, he has now a professional refrigerator, and he also is able to he can have the temperature looked at right there. And he's thrilled, and people are thrilled because when they're getting fresh fruits and vegetables, he has some place to store them until they can distribute them. And sometimes it's within one day, but they'll get them and they have a place to store them now, and they can take more. So same as similar, we do a policy, practice, and systems change. I should just wear a shirt with that because I just spoke to I call him our freshman. He is a New York State Assemblyman, Patrick Carroll, and really looking at in every policy that the state is looking at. I talked about having health in every policy, and we were talking about school districts and having free lunches. That's something, a universal free lunch that Governor Kathy Hochul is working on. But I said, a lot of these schools do not have that capacity to have, a lot of it is just heat and eat. And I said, they don't have the capacity to have storage, cooking equipment in a school cafeteria. The kitchen is not equipped. And he said, oh, I never thought of that. So talking about how to look at funds that could possibly be in that corner to look at capacity for and maybe a kitchen redo for our school kitchens. Food pantries, that is Senator Weber. We spoke to him earlier last year, and also Assemblyman Chris Ekis, and talked about the need for more funding and also to retain funding, and looking at what that means for healthier food. And I think Amanda also highlighted that is we don't prevention is the essence of health, because we don't want to have you to have a chronic disease. Chronic disease, I would much rather spend the money on fruits and vegetables and healthy foods than medicine. Okay, our farmers market nutrition program. I'm looking at my time. Okay, farmers market nutrition program. In Rockland, we have a FMMP that is funding for WIC and our Office of the Aging. It is a voucher system. People who are income eligible can get up to 25. Actually, families for WIC, it's I believe, $24 per person per season if that child is over 9 months old. So in a season, you have two children and yourself are pregnant, you can almost have about almost $75 worth of produce. And you can get that at a farmer's market or a farm stand all over the state of New York. This one is my friend Javier. He is from J&D Farms, and we looked at having the farm stand at the library. We wanted it to be accessible in a place that the bus goes by, people are already visiting, they already go to the library for other things. So this was, I say, my baby, but I worked on it with the Finkelstein Memorial Library staff. Fantastic, really. It has, this is I say a labor of love, but it's working. Uh, Love it. And you don't have to, and also if you're a veteran, we have the Fresh Connect checks. That's with our Veterans Association. That's $50 for the season. Some start in June, some start in July. You can use those funds all the way until November 30th. Department of Social Services, SNAP is a Supplemental Nutrition Assistance Program. That is also income eligible, but you might be surprised. You might be able to have that option. Please contact the SNAP unit, but also there's the other piece that I don't know if many people know about. Catholic Community Services has a NOEP, a Nutrition Outreach Education Program. You can call them and they will walk you through, or they're also at different areas in the county. They're also at People to People in Nanuet, but you can call them and they can walk you through that. To me, I find paperwork and forms a little bit overwhelming, but, and if I spoke a different language, I would also find that overwhelming how to fill this out. Jillian and Greasley will walk them through it. They are happy to do that. And they will walk them through and show them that a family could avail themselves to several programs. Okay, lastly is our Rockland County Office of the Aging. The Rockland County Office of the Aging has a wonderful dietitian, James Lowry. And if you are over the age of 60 years young, you can avail yourself to the services of James. You can call and he can help you with meal planning, help you with, if you have a concern that your doctor told you have to eat more fiber, he can help you. He can help you with diabetes menu planning. He's really, and also, so if you may say, you know what, the doctor told someone if they may be gluten-free, they need to have a good gluten-free diet, James will walk you through. That's a service. And there's also FMMP for seniors. So we'll be looking at that. FMMP brings, I believe last year it was over $150,000 food dollars that can be spent in Rockland. So really, that's a lot of produce. Please use them and use these services. Please get in touch with us. Rockland County, 845-364-2500. And if you want to be in the know about the best nutrition information, go social media, Facebook, X, Instagram, we're on. Okay, I think I'm done. I'll stop sharing. Julian, you're on. And remember, it's National Nutrition Month. Try something new. Try a new fruit or vegetable. Okay, if you don't have to like it, you might. You just might. Okay, I'm going to stop sharing.
Thank you, Michelle. And as Michelle said, Julian, you're up. So just start by telling us a little bit about you and Touch, please.
Yes. So yeah, I'm Julian Palmer, Executive Director at Touch. Together, our unity can heal. I've been in Rockland now for over 25 years. Touch is also the lead agency for Rockland Community Against Hunger, and I'm especially glad to be speaking to folks through Montefiore because I have some background in public health. I was communications director for the National Center for Children in Poverty, based at the Columbia School of Public Health for about 6 years. And I think seeing the connections between nutrition and public health is a very important thing. Oh, and also, I guess since I'm speaking to a hospital, I'll mention my daughter is expected to graduate from medical school this year. So who knows? Maybe she'll be going to Montefiore looking for a job soon.
Yeah, that's great news.
So let me see. Do you guys see the PowerPoint yet?
Yes.
Okay. So yeah, also before I get into it, I want to say it's an honor to follow Michelle and Amanda, who are two great nutrition educators who have literally helped thousands of people have healthier lives. And they're great partners, working. We do a lot of work with SNAP-Ed and the Department of Health, and they both have done multiple nutrition ed presentations at Touch, so we appreciate them. So since it's Nutrition Month, I wanted to start just with the starting premise that food is love, food is life, and far too many people don't have access to the nutritious food they need to live long and healthy lives. I mean, it's really core to our existence as human beings. So we do a lot of work to get the healthy food to people that they need. So I want to talk some about that, the food insecurity in Rockland, how we're addressing it, some of the collaborations we do, our new work with the Food as Medicine Coalition and emphasis on food as medicine. And then maybe there's some things we can do together, all of us on this Zoom, to further that. And we're also part of the new Hudson Valley Social Care Network. So it's a lot to cover, but I'll see how much I can get through and leave some time for questions. So just first, a little bit about Touch. For quick background, we've been around since 1990. We started as a food pantry for people with HIV and AIDS, uh, having volunteers prepare homemade meals and delivering it to them. Then we became a Ryan White pantry. Then we expanded our food service to address people with chronic illness more broadly. And now we're the lead agency for Rockland Community Against Hunger, working with Catholic Charities, Bridges, Meals on Wheels, to deliver food for over 1 million meals a year in Rockland County. And those are some of our great team members there. Yeah, and that healthier individuals, stronger communities is our tagline, basically. So some of our key programs, we started this Get Fresh mass distributions of food in 2011, regularly at the Clover Stadium in Pomona, where we distribute food to about 20 pantries that then distribute it to people throughout Rockland County. We manage a hunger prevention and nutrition assistance program grant, FEMA grants, emergency food service grants. And we also have a registered dietitian who gives individualized counseling through our Eating Well Medical Nutrition Therapy program and also through our Ryan White program. So we really respect nutrition educators like Michelle and Amanda and you, Sandra, who do the nutrition education that's needed. So we don't want to just prevent hunger. We want to promote health through food and access to nutritious food. So I think Amanda touched on it before, but over 49,000 people living in poverty in Rockland County, supposedly like a wealthy, suburban county, but there's a lot of poverty and food insecurity, unfortunately. And about 1 out of every 4 children is living in poverty in this county and stressed, and living in economically stressed families. 40% are economically insecure, according to the United Way's Alice report. So that's, almost it's 2 out of every 5 people in our county are economically insecure. And well, I don't want to say too much about what might be happening with some of the budget cuts or tax plans, but it could be getting worse in our county if we don't address some of these problems. And it's also, it hits people of color harder too. They're more likely to face food insecurity, and that inequity needs to be recognized. So that's the problem. You can see here that Touch is the lead agency of Rockland Community Against Hunger. We work with all these different agencies that you see on the screen here and more. So it's an incredible collaboration. And Touch, by the way, stands for Together Our Unity Can Heal. And I think unity, collaboration, and healing are what we're all about. And we invite you all to join us in that effort. So yeah, now one of our main programs with the Rockland Community Against Hunger is our food recovery program with all these partners that I mentioned. I won't go through all the points, but basically we we pick up from about 20 retail stores. We collect food when they're overstocked, and we distribute that to about 40 food pantries across the county. And it's over 1 million pounds of food that could otherwise potentially go to waste, but we get it while it's still fresh and nutritious. And we emphasize getting fresh produce whenever possible. We work with the Cornell Gleaning Program uh, and Nourish New York, another program to get food from local farmers so we can distribute as much healthy, nutritious food as possible and prevent food waste at the same time. And also, we do have a website. Rocklandhunger.org is a website for the Rockland Community Against Hunger. And there you can find a list of over 40 food pantries throughout the county. So anyone who needs food, you can refer them to rocklandhunger.org and they can find a pantry uh, close to where they live where they can get food. Now, yeah, you can see the growth of this program. This picture includes some of the staff and volunteers who make it go. Great people doing wonderful work. And you can see our food recovery program started in 2018 with a goal of recovering 12,000 pounds and seeing if we could distribute it. And we got to 40,000 in the first year, which we thought was good. But now we're up to 4 straight years with distributing over 1 million pounds of food to people in Rockland County through this program. And also, we do other work too. In addition to that, let's see, there's some nice pictures here. There's a picture of me with our senior case manager, Enan, who's been with us for 27 years and is from Haiti originally. We have a multilingual staff that speaks French, Haitian, Creole, Spanish, for that matter, Italian, Swedish, Arabic, but it's a wonderful team, and it shows the strength of diversity in meeting the needs of the community. Uh, let's see, and the picture in the bottom right is the food bank, regional food bank gave us that truck that you see behind us in that picture in the lower right. And you might see that now we got the big logo for Touch and Rockland Community Against Hunger. You might see it driving around the county distributing food or picking up food from local markets. Oh, and that other picture, we won the Equal Justice Award from the Legal Aid Society for working with a lot of our clients and helping them deal with issues, avoiding eviction, things like that, or making sure their immigration status is solid. So we also do medical case management in addition to the nutrition education and the food distribution. Then let's see, as far as food as medicine, I think you all may know the New York State prevention agenda focuses on prevention. Michelle, I'm sure, is deeply into that. And nutrition, security, and healthy eating are recognized as key factors in the prevention agenda. So that's especially, I think, for Montefiore. I'm sure you guys understand that, but we're here to partner with you in addressing that issue and helping to promote nutrition, security, and healthy eating to improve health outcomes and be an active part of the prevention agenda. And then we're also part of this New York State Food as Medicine project, where we envision a healthcare system in which all New Yorkers who are food insecure, at risk of or suffering from a medical condition impacted by food and nutrition have access to food as medicine interventions to improve their health and quality of life. So that's an exciting new coalition that we've been doing a lot of work with lately. I guess I'll just emphasize the last bullet on this slide for time reasons that the evidence there's more and more evidence demonstrating the ability of nutrition interventions to address the connection between food and health. And I can share, there's a lot of studies to that effect that I'd be happy to share with anyone on this Zoom or anyone watching the recording of this Zoom. And yeah, the national call to action on food as medicine there are a few specific things that we're working on through the social care network that could be funded now through this Medicaid waiver, the Section 1115 Medicaid waiver, which would fund things like medically tailored meals, medically tailored groceries, produce prescriptions, and well, Amanda mentioned the fruits and vegetables RX. Hopefully that will be funded through this. And nutrition education programs like the great things that Michelle and Amanda and our registered dietitian here do. So that would be a wonderful thing. And we're hoping that this new social care network will help fund more of this kind of work to promote nutrition education and food as medicine. And I'm on the board of this network for the 7 counties in the Hudson Valley, and it's still in the early phases. So we're really hoping it gets momentum and that it allowed the network has a Medicaid waiver to use Medicaid funds to provide interventions related to health related social needs, and that, including food insecurity, things that people need, housing, transportation, care management, things like that, the social determinants of health that can be addressed before people end up in the hospital. I mean, it's great to be talking to folks working at a hospital, but hopefully, not as many people have to go to you if we do this kind of prevention work. Uh, and then, yeah, this just has some more background on the CARE network. I know that the CARE network is in contact with Montefiore and looking for ways where you guys could screen people that would be referred to the CARE network and then referred to individual agencies to provide the services like nutrition services that address health-related social needs. So hopefully we'll be able to do a lot of that and get referrals and help reduce rehospitalization rates and improve health outcomes and prevent people from needing to go to the hospital in the first place. So that's CARE Network is active in 7 counties throughout the Hudson Valley. And there's a 2-year waiver going to March 2027 for this waiver. And so far it has not been affected by any of the cuts in Washington. So we are looking forward to showing that investing in meeting health-related social needs actually will save a lot of money and improve health outcomes and be a real example of government efficiency. Yeah, so that's just some more background on the CARE network. I mean, it's almost $45 million in infrastructure dollars for the Hudson Valley region to build up this network. And over 50% of the budget is to be dispersed to community-based organizations to address the health-related social needs, but also very important to partner with hospital networks as well. So we're looking forward to doing more of that with you guys. And here's the flow of how it would work. I won't go into great detail because of time, but you can see the idea is for this network is to screen everybody on Medicaid in New York State through all the regional networks within 2 years, and then identify if they're eligible for special enhanced services to address health-related social needs. And, again, including housing, food security, transportation, employment, education. So you guys, I know you have a screening system at Montefiore, and when you screen people, I believe the idea is they'll be referred to the network, and then the network will refer it on to individual service providers, and we'll be able to do more to address those needs collectively. So, yeah. And then here's another idea just showing the system for the CARE network and care coordination. And you can see that it's the idea is to create these regional and local systems of care and referring people to the appropriate screening and referring people to the appropriate services. And then, so in addition to that, another way we can make a difference is legislative advocacy and public education and action. So we're calling right now to make sure that there's funding for the HIPNAP, Hunger Prevention and Nutrition Assistance Program in Albany, the Nourish New York for food pantries to purchase food from local farms and distribute it. So, we want to also promote action and make sure there's adequate funding for nutrition assistance programs and for food pantries to meet the needs in the community. And yeah, just things that we'd ask each person, who can hear my voice to consider, supporting Touch and Rockland Community Against Hunger, volunteer, at a local food pantry, visit rocklandhunger.org, contact elected officials to support funding for nutrition programs. And then you'd follow us on Facebook, Instagram, build the community through social media. We have an Instagram page, touch.ny on Instagram, or you can find us on Facebook and Rockland Hunger as well. So join the community, be part of the collaboration and healing and addressing food insecurity. We hope you will join us. And then here's my contact info, or Magda, who coordinates the food recovery program. So, you're all encouraged to email or call or get in touch if you would like to learn more or to help or get a copy of this presentation. There's so much need out there, and it's a kind of an uncertain time now in the world and in the United States and in Rockland County with what's happening with government programs. And we really need to work together to address the problems that are out there, prevent the problems that might emerge, and support each other, to get through challenging times. So thank you, and I'd be happy to answer any questions.
Well, thank you, Julian, for this great presentation, and also to Michelle and Amanda. I think that people, when they see the recording, if they are not seeing this live, they're going to be amazed to see how much we have, from education to clinical programs to food itself. There is no reason why to eat poorly or scarce here in Rockland with all these programs. And then I'm also happy to tell everyone out there that now Montefiore Nyack has also a health equity program that is dedicated to the food insecurity of our residents. So we're doing everything we can in order to help, especially patients who are leaving the hospital, to make sure that they have proper food at home to heal completely. And as you just said, we all dream with a hospital with no patients, right? Wouldn't that be ideal? Like, we're just here for an emergency or something, and that's about it, because everybody's so healthy. That would be wonderful. Maybe one day. So let's go to some questions. Amanda, I have a question for you. The education that you provide through SNAP, is it for everyone, or if people are interested in getting some of those programs, what do they do?
So if folks are interested, so we typically go by organization. Like, I'll reach out to organizations if they want nutrition education. They can, ask, we can coordinate a time. I can come in and deliver a workshop. If they are even if they are part of a school district, if they want to talk to, like, there's the family resource coordinators, there's, contacts at the school that they can reach out to, because we're always happy to come anytime. We do workshops for anyone ages 5 and up. We don't interfere with WIC, so we don't do 5 and under. So we do 5 and up. But we do parents as well. So if there is a school district that's one of ours, like I said, North Rockland, East Ramapo, some of Suffern, if they want to reach out to a school official, or if they're a member of an organization, they have like a local church or something where like it's in an area where they have higher free or reduced price lunch rates, it has to be 50 or higher, we can come in and do workshops. I can always provide my contact information.
Awesome. Thank you so much. And Michelle, a question for you. What's the number for the Tai Chi program for arthritis? I know you shared it in the chat, but it might be good to just say it loud as well.
845-364-2500. We work in combination with our Office of the Aging, so check there also, and that's 364-2511. But
And Julian, the last question is for you right before we leave this webinar. What can do people to support the efforts of Touch?
Yeah, I mean, that last slide, we listed a bunch of things, but you could email us at info@touch-ny.org if you're interested in volunteering, or go to touchny.org, our website, and you can make a donation or express your interest in volunteering. Yeah, and just kind of spread the word about the things we've been talking about today. Be open to collaboration. Also, there those I don't know if I could share my PowerPoint, but there's also, there's legislation in Albany for supporting HIPNAP and Nourish New York and nutrition programs that really are very needed.
Excellent. Well, thank you so much to the three of you. This has been very fun, but also very informative, most of all. So next week, for those who follow community chats, we have rights of patients and families. So we're going to discuss all the rights that you have if you are a patient and you come to the hospital, and you just don't have to say yes to everything. You have rights and you have the right to talk as well. So we're going to learn about what they are and how we can do that. So thank you so much, and I will see you very soon. Thank you.